Dr. Potter believes her videos are part of why her center remains out of United's network.
You think this is retaliation?
Absolutely.
United Healthcare says not so.
And MAGA wants to talk about undocumented immigrants being the criminals? These people are the ones that should be in a prison surrounded by alligators, if you ask me. This is absurd.
Hey, it's Jordan with Status Coup.
This is Ashley with Status Coup.
On the ground.
In Philadelphia.
Flint, Michigan. East Palestine, Ohio. Please support the leading independent news outlet on the ground.
Covering what the corporate media covers up.
Hey, it's Jordan with Status Coup. Remember that fine doctor down in Texas who had the gall to do a video exposing United Healthcare for calling her while she was mid-surgery on a cancer patient to try and deny her patient's overnight hospital stay? Well, now they're trying to bankrupt her. That's right. While United Healthcare is under criminal and civil investigation by the Department of Justice, don't hold your breath that the Department of Justice is actually going to convict. They'll just get a fine. They're trying to bankrupt the doctor who actually had the gall to expose them. If you don't remember, let me show you the original video. This is Dr. Elizabeth Potter, does breast reconstruction surgery on cancer patients, does other type of plastic surgery for medical needs. This was her video many months ago exposing the call she got mid-surgery from United Healthcare.
It's 2025 and insurance just keeps getting worse. I just did 2 bilateral deeps and 2 bilateral tissue expanders for patients. And I've never had this happen before, but during the second deep, I got a phone call into the operating room saying that United Healthcare wanted me to call them about one of the patients who was having surgery today, who was actually asleep having surgery. And, said I had to call right now. So I scrubbed out of my case and I called United Healthcare, and the gentleman said he needed some information about her, wanted to know her diagnosis and whether her inpatient stay should be justified. And I was like, do you understand that she's asleep right now and she has breast cancer? And the gentleman said, actually, I don't. That's a different department that would know that information. And I was like, well, she does need to stay overnight tonight. And you have all the information with you because I got approval for this surgery. And I need to go back and be with my patient now. But yeah, it's out of control. Insurance is out of control. I have no other words.
Well, United Healthcare thought she got out of control, and they sent her about a 7-page letter basically demanding she take down her videos, apologize, or they would take significant legal action, essentially threatening to bankrupt her. To her credit, which is brave, she basically told them to fuck themselves, respectfully. Well, now United Healthcare is playing fast and loose with the in-network versus out-of-network coverage that they allow doctors to participate in to essentially screw her, essentially make it so she cannot actually treat patients at her facility down in Texas. This is from NBC News.
Do you have an alcohol swab, please?
Dr. Elizabeth Potter says the Austin, Texas surgery center she opened in April of last year is at risk of going under.
Can we please get this implant open?
She specializes in a complex breast reconstruction procedure and says most of her patients are cancer survivors. While she is in United Healthcare's network as a surgeon, her surgery center is not.
Why do you think you were denied access?
Money. They have had a PR nightmare of a year. I think they're angry.
Because of the videos you've posted?
Because of all of it.
It's gotten ridiculous that insurance companies really do control when and what kind of care we deliver.
In January, Dr. Potter started posting videos critical of United.
I had another patient come in and share with me that United denied her inpatient stay.
Like this one, where she says the insurer interrupted a surgery in progress.
I got a phone call into the operating room saying that United Healthcare wanted me to call them.
United pushing back, saying United Healthcare did not ask, nor would it ever expect a physician to interrupt patient care to return a phone call.
United Healthcare says they did not ask you to step out of surgery.
Yeah, I know. Did they physically make me leave the OR? No. But in 2025, with insurance, when they say jump, I say how high.
Dr. Potter believes her videos are part of why her center remains out of United's network.
You think this is retaliation?
Absolutely.
United Healthcare says not so, that its members have sufficient options for care in the region without her surgery center, and that it informed Dr. Potter on October 1st of last year that it wasn't accepting new surgery centers in her area, well before she posted any videos. Dr. Potter says there were ongoing discussions about her center getting into the network that stopped once she started speaking out.
And I don't know how United defines negotiations. There were emails between our consultants and folks at United after October 1st.
So translated, United Healthcare, after this good doctor who treats cancer patients, and by the way, takes Medicaid patients, which not all plastic surgeons, reconstruction surgeons do, they basically retaliated against her by saying, yeah, we're not going to allow your actual facility that you took out a couple $1 million loan on to open. We're not going to allow that to be in network. So you, the doctor, might be in network, but we're not going to actually allow your center to be in network. So you'll basically have to do the surgeries like in an alley. And MAGA wants to talk about undocumented immigrants being the criminals. These people are the ones that should be in a prison surrounded by alligators, if you ask me. This is absurd. Absurd. And by the way, because I know this in the case of my coverage of Flint and many other stories, there's a whole lot of doctors, of nurses, of hospital executives that stay quiet when unethical or downright criminal things are going on to keep their jobs, to keep their paycheck. You know, they got to feed their kids. They do not have the courage to speak out against unethical or illegal things going on like this doctor did. I could go down the list of things I know happened in the case of Flint and other places, but I never had enough information or corroborating evidence to report. So she deserves a medal, not essentially nearly going bankrupt, which she's near bankruptcy because she cannot actually treat a lot of her patients in the center because if they have United, it's out of network. This is how absurdly, intentionally convoluted the United States for-profit predatory health insurance scam is. It makes it so good people like her, who, by the way, left a comfortable job in a hospital to open up her own facility where she could take Medicaid patients, people who maybe have lesser means, and help them with things like reconstructive breast surgery for cancer patients. It makes it so they could barely live. They could barely function. And now she's going bankrupt. This is textbook retaliation that's going on. And what do you expect from United Healthcare, who, as I said, is currently under civil and criminal investigation? I'm not going to hold my breath that the Trump Department of Justice is actually going to, be opening up prison doors for United Healthcare's executives. If you don't know, this was recent. United Health says it's under federal investigation for civil fraud. Shares of United Health Group slipped Thursday after the healthcare giant said it was under a Department of Justice investigation. The company said it has started complying with both criminal and civil requests from federal investigators, and it was cooperating with them. Quote, United Health has a long record of responsible conduct and effective compliance, blah, blah, blah. Yeah, of course. And by the way, while they are essentially trying to retaliate by bankrupting the good doctor, it recently came out that United Health was basically scamming the elderly by depriving them or trying to limit the amount of hospital transfers elderly people in nursing homes could have. This was great reporting from The Guardian. Revealed United Health secretly paid nursing homes to reduce hospital transfers. United Health Group, the nation's largest healthcare conglomerate, has secretly paid nursing homes thousands in bonuses to help slash hospital transfers for ailing residents, part of a series of cost-cutting tactics that has saved the company millions, but at times risked residents' health, a Guardian investigation has found. Those secret bonuses have been paid out as part of a United Health program that stations the company's own medical team in nursing homes and pushes them to cut care expenses for residents covered by the insurance giant. In several cases identified by The Guardian, nursing home residents who needed immediate hospice care under the program failed to receive it after interventions from United Health staffers. At least one lived with permanent brain damage following his delayed transfer, according to confidential nursing home incident log recordings and photo evidence. Quote, "No one is truly investigating when a patient suffers harm. Absolutely no one," said one current United Health nurse practitioner who recently filed a congressional complaint about the nursing home program. These incidents are hidden, downplayed, and minimized. The sense is, well, they're medically frail and no one lives forever. Maybe that should be United Health's new marketing campaign. No one lives forever. I mean, it's just absolutely insane that this legalized corruption, I mean, financial boondoggles are going on in America. And a lot of the country, I mean, perhaps 30, 40%, think the biggest issue is undocumented immigrants. When they are being screwed, you are being screwed. Not to mention Trump and his minions just cut, I mean, what was it, 12, 13 million people off Medicaid? Probably would be more than that by the end of it. I mean, it's just vile, absolutely vile what's going on in this country. I want to read you a little bit more about what the good doctor is dealing with here, because she will go bankrupt if United Healthcare is able to get away with this. Without being able to accept United Healthcare patients in network, Potter said she likely won't be able to stay in business. While she's in talks to join other insurer networks, United Health is the second biggest player in the market, according to the Texas Department of Insurance. Potter said she's currently $5 million in debt, and her husband had to cash out of his 401k to help them stay afloat. Quote, "My goal has always been, how do I make this work? I'm a problem solver. The fact that they hold the strings in that way, that they're able to control the economics of the practice of medicine down to the facility that I'm operating in, it seems just arbitrary and also somewhat cruel." How's that for a free market when predatory, murderous health insurance giants can basically stop surgeons who try and help cancer patients reconstruct their breasts and other things, basically block them from operating? Doesn't sound like a free market to me. Sounds like a financial boondoggle. We will continue covering United Health's predatory practices, which is killing millions of people a year. And we will continue highlighting brave whistleblowers like Dr. Elizabeth Potter. Check her videos out on TikTok and Instagram. I have reached out to her in the past for an interview. I will continue to reach out to her. And please support Status Coup for as low as $5 a month. We really, really need to grow our paid membership to continue expanding, hiring more people, and staying on these important stories. StatusCoup.com/join.